So this is one of the aspects of preventative medicine and lifestyle medicine. So by taking without medication, with just improving your lifestyle factors, what you eat, what you put into your body, so potentially less carbohydrates. There's arguments where how much carbohydrates contribute to sugar, but processed foods again and sugar itself, we've got to be very, very mindful. But also, nutrition is only one part of it. It's also what are we actually doing with the body? Okay, how are we using energy and burning it? That so exercise, sport, that sort of thing. So very, 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 very important.
So in terms of myself there, Johnny, obviously I'm in the low range. That wouldn't be a concern. The fact I'm very low on that, because obviously you've got your normal range, your high range, and your low. There's not concerns because I'm really close to the bottom of the lower range, or is that?
Yeah, I think for now, so we're not worried about things being too low. Now I must make it clear, this is not blood sugar or blood glucose. That is
No.
a very quick snapshot of how your levels are right now, and it
Yeah.
can be dangerous to have low blood sugar. Again, it also can be dangerous to consistently have too high levels of blood sugar,
Yeah.
and our body is very good at regulating that with one of the most famous hormones, insulin. Okay,
Excellent.
and when insulin resistance happens, that is essentially the start of type 2 diabetes. Some people don't even manufacture insulin, so that's typically type 1 diabetes. Okay.
Yeah.
So there's a whole host of things. And again, that's where the medical consult goes. And when we ask about diagnosed conditions and prescribed medications, we can work out. If someone tells me they're on metformin, that is obviously a commonly used medication for type 2 diabetes. It's also used for other things as well, but typically type 2 diabetes. Very popular, very topical GLP-1s, glucagon-like peptide 1 medications. Now, that is obviously a natural occurring hormone, which regulates appetite and obviously therefore has a knock-on impact on weight control and obesity. But GLP-1 medications did start off life in some of the earlier forms for diabetic patients,
Right.
and have now been extended to cover many things, but obviously weight loss. So these are your weight loss medications or weight loss injections. The common ones are semaglutide and tirzepatide. That's the generic name. The drug names that people will know are Wegovy, or Ozempic is actually the same thing but used for diabetes. And
Yeah.
obviously Mounjaro is a slightly different compound. It's a GLP and GIP, so two hormones. And that final one, because I know it's very topical, people are always asking and curious about peptides. So GLP-1 medications are peptides, glucagon-like peptide, okay? They are obviously pharmaceutical grade. They have gone through rigorous clinical trials, whereas there are a lot of peptides that are currently online for research purposes that haven't gone through some of the clinical trials. Some are or have been deregulated, and again, they're not typically available in the UK, prescribed by doctors yet. In the US, they are going through decategorization by the FDA. There is some interesting, promising research. A lot of it is quite early. A lot of it may also be in animal studies. But obviously, a lot of people know on social media that people are taking these. Again, in the US, that is a
Yeah.
big phenomenon, and reporting lots of positives. So a very exciting compound to come out is also made by the makers of Mounjaro, so Eli Lilly, the pharmaceutical company, called retatrutide, or Reta for short. Some people call it the triple G because of three aspects or hormones it's working on. And this is in the early phase 2 research is showing even better weight loss compared to Manjaro or Wegovy. And it's also maintaining muscle mass, which is a very important thing. And I think a lot of, especially men, would be interested to hear that. Obviously, one of the concerns is you take something like Wegovy or Manjaro, and yes, you lose weight, but you lose your lean muscle. And that is
Yeah. Yeah.
associated with some people even having kind of Ozempic face or jaw, and lots of terms in the press. But actually, Retta is showing some promise there. So it could be a very interesting compound. And why do I bring up GLP-1s, even though that's not the core focus here of this talk? Because a lot of people are wondering whether that can be used safely with testosterone, and what's the relationship. And I can say that in some cases we have patients who are on both medications. It's important they're both being monitored and um, prescribed appropriately. But actually, they can work in synergy. One is helping with weight loss, including fat, but maybe some lean muscle. there has to be supported with adequate protein. And that's why I was curious about your grams of protein. That's probably where you would track your macros and actually want to aim for at least 200 grams of protein. Again, depends on the person's starting weight and other factors. But and testosterone can help support that anabolism. Okay, so support counter any muscle loss. And it's important to say that also when low levels of testosterone are found, that typically people have higher adipose tissue, higher fat count as well. So and some people would obviously get then more interested in weight loss, but actually it's important to say that if you optimize your testosterone levels, you might already get that same effect as well.
Yeah.
Very important to really dig deep. And I think the biochemistry here, so these biomarkers, the blood that you and I are talking about, are really important. If you don't have any of this, how do you know, right?
Yeah. And that's the concern. A lot of people online taking different things without consultations and looking for that quick fix. Again, talking about weight loss injections. As a fitness coach, a lot of people automatically think I'm against them, but I absolutely understand they've got the place, and particularly for certain people, they are definitely at least a short-term solution, but they're only part of the thing. Alongside that, people shouldn't just think, right, I can take this injection that will allow me to drink what I want, eat what I want, do no exercise. That's where the real kind. Some people do see solutions like that. That yeah, I'm now on this injection, and that just means everything's taken care of. It's still about getting that balance of the right nutrition. It's not a case of just taking something and everything becomes perfect. It really doesn't work like that.
And same for TRT, same for anything. It's also important to say these are not quick fixes. Okay, they're not designed to be just taken for a month and then stop. And it is, and this is the argument for also doing things in a manner where there's a consultation or support from a provider, who is qualified and trained and insured to do this legally and properly, and has the expertise as well to advise.
Yeah.
I'm not an expert on nutrition and physical training and things like that, but I obviously do have that network. I do have that knowledge and aspects of it, and I also, it's very important to find people who are aware of the limitations and can make recommendations. Say, actually, I suggest speaking to this person, or doing a bit more work here.
Yeah.
Okay, so let's continue, because I think we've still got a fair few biomarkers to go.
Yeah.
We have also touched on other pieces as we've done it. So the next one down is hemoglobin. And remember, I've said the HB and the HbA1c is hemoglobin. So this is, responsible for the oxygen carrying capacity of red blood cells. It's very important you carry oxygen around our body. That's how we keep our cells alive. We thrive on oxygen, obviously. It's important we don't have too high levels of oxygen. That can cause oxidative stress or damage, and that is one of the potential possible contributors to aging. But hemoglobin is what we look at for a condition known as anemia. It's very commonly, or more common with women, especially iron deficiency anemia. That's the most common cause of anemia globally or worldwide.
Yeah.
And it's more common in women, typically because of menstruation. So that's obviously monthly bleeding. So blood loss is obviously a factor. But it can also be a nutritional deficiency as well. So you can get low iron because of not having enough iron sources, which yes, obviously is found from meat, and red meat in particular, but it's not the only source.
No.
So typically, yes, vegans and vegetarians and pescatarians may be more prone to it. And another cause, common nutritional cause of anemia is B12, vitamin B12 deficiency. Again, B12 found in typically poultry, dairy, meat as well. So again, something that we do find more so with people's diets who don't contain those. But it's also important to say that
vegetarians and vegans do take B12 supplements and
supplements, yes,
iron supplements, because,
yeah,
like I say, it's not just in meats, but
absolutely. It's not only just in meats. That's quite right. And supplements can definitely help. But some people actually are almost immune to it. So basically, their body produces antibodies, so things that block oral consumption, or whether that's supplements or whether that's from food sources. This is known as pernicious anemia. Okay,
Right.
and it can be quite hard to diagnose, but essentially you could be taking all the supplements and always still be anemic. And the symptoms of anemia are important to highlight because it could be low energy, fatigue, shortness of breath, tiredness, etc. Irritability, fatigue, brain fog. It extends across a lot of things, which even people would find with low testosterone. And so there are
Yeah.
similarities. That's one of the reasons we're talking about it at length here, and obviously testing it. Now, if someone has taken measures to address this and they're still not getting it, it's worth speaking with a clinician about the prospect of pernicious anemia. It can be tested by doing antibody testing. That's quite expensive. It's not commonly done, but typically people look at bypassing the gut and the gastrointestinal tract. So that might be like having a B12 injection, which you might have seen.
Yeah.
Again, people do that for lots of reasons. There are clinics that sort of advertise and promote these for energy, but actually there's a good medical reason for this. So pernicious anemia and other gut related medical conditions mean some people just cannot sadly absorb these through traditional means, so food or supplements, and may need to look at that. So it's worth talking about hemoglobin. It's worth talking about anemia and being aware of it. Again, having 162 grams per liter, that's quite a healthy level of hemoglobin. So we're not concerned. We would be concerned for a man somewhere under 130 or 120 grams per liter. That would be sort of borderline. And then obviously as it drops off, it goes 110, 190 would be more concerned. Many places in hospitals have a cutoff of 70 grams per liter being quite concerning and quite dangerous. And that might be the threshold in some hospitals where I have worked, where we consider doing a transfusion, so giving someone blood products. Okay,
Yeah.
that's obviously quite critical. And usually symptoms here would be very pronounced, not just tiredness. People may be having chest pain, real difficulty breathing, really, really struggling, might be even close to immobile, probably collapsing, fainting, and that's usually what's brought them into a A&E hospital.
Yeah.
Um, Obviously, there are measures before that. So, like I say, all supplementation can improve levels if it's iron related. Iron infusions are sometimes done as well. I did spend a bit of time working in an iron clinic on Harley Street some years ago, so you can see all of those
Yeah.
learnings are kind of now coming out of me. So, not something that obviously we treat at TED's Health, but something we look for, we recognise, we counsel, and we speak on.
Yeah.
And sorry, final thing to say is it's also important to find out if someone is taking, other supplements that could be contributing to it or affecting hormones. Other medication might have that as a side effect. Some food types, even soya-based products, sometimes being thought to have some influence as well. So, building that bigger picture of kind of diet, nutrition, what is being put into the body, other medications, supplements, etc., help us obviously identify the root cause.
Yeah. Absolutely. It really does bring home having all these different markers, how they play an impact. Because so many people, and being a fitness coach, I hear it all the time where people straight away, I'm feeling lethargic, I have this, I must have this, or I must have this. And just seeing all this and listening to you, Johnny, just brings home how many different things it can. It is important to just see that bigger picture and say, yes, it could be that, and there's a chance it's that, but it also could be that, and we could be that. And by seeing these values all together, it really helps pinpoint more what it is, doesn't it? So yeah, brilliant. And so,
Yeah,
and of course, there's so many people now because of what we've already talked about online, and people can get hold of things so they can self-diagnose and then get the treatment they have self-diagnosed as being right, can't they? Without ever speaking to an expert, without ever getting any readings. It's just a matter of I feel this, so I assume it's that, and that's what I'm going to take, which is in fact quite scary. I'm not saying some people they might diagnose it right, but there's always a big chance
yeah.
that
And,
they're
and
not.
and and just to make something kind of relatable to people that might be listening, I mean, one example is somebody might go to try and find a cheap blood test and just say, I just want to know my testosterone, and they find out it's low, and then say, right, I need TRT. And actually, if you've not looked at prolactin, you might be missing actually the underlying cause.
Yeah, yeah,
Um,
yeah.
so that's again the reason why why we're doing this quite lengthy conversation over 22 biomarkers. This is part of the reason, right? This is why we've designed this
Absolutely.
panel, to really dig deeper and try and find or at least be happy that we've tried to exclude many things. And
Yeah,
again, if you'd told me about, actually, no, I've got family history of thyroid problems, and or I'm on medication, then we'd obviously want to look at those numbers as well. So there's
yeah,
not everything on here is not the complete picture. This is obviously the consultation as well that one does with Ted Self.
yeah.
I think we've got to the bottom of the list, haven't we, Ian?
I think we have, haven't we? And I think everyone who watches this is going to learn a heck of a lot, because I certainly have, and you've explained it brilliantly, Johnny. Because, like I say, there's certain things that I think, yeah, I know that, and then other ones are like, oh, what does that mean? And I think you've gone into real detail how everything fits together, how it isn't just about that marker means. It might flag up, but it's not doom and gloom. It's about everything fitting together, getting that overall picture, and then it allows us or you or whoever is doing it to come up with the right solution. I think too many people are just self-diagnosing, seeing what people are saying on social media, and just going, "I've got this, I've got that. That means I've got to do this." And it's a lot more detailed than that, as anyone who's watched us talk for the last hour and a half will now know. Yeah, so I think this has absolutely been brilliant, and I certainly think I'll get another blood test done, and we'll do it again. Maybe not an hour and a half. We'll just go back and look at how those changes have come about. But yeah, brilliant.
Absolutely.